This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Welcome back. Our first guest is a guest we've had before, Dr. Tyson Hawkins, very recently, as a matter of fact, internal medicine practitioner at PeaceHealth Medical Group in Whatcom County. And, of course, we're talking, like we did a couple of weeks ago, about screening for men's health in ages 40 to 60 particularly, but something men all need to be aware of, Shannon.
Yeah, men, us men and you men out there, we're reluctant to seek medical attention. And, there are certain screenings that we should be getting in various stages of our life. Dr. Hawkins is coming back to talk about that 40 to 60 range.
All right, here we go with Shannon O'Kelly and Dr. Hawkins.
Dr. Tyson Hawkins, welcome back to Health Talk. Thanks for joining us again. How are you?
I'm doing great. Thanks for having me.
Yeah, last time we were talking about these men's screenings, men's health screenings. We all know that men are less likely to reach out and schedule appointments with doctors. And the need is you have to be screened at certain portions of your life or certain things that we just want to take a look at to make sure we catch anything early. Because you and I both know the earlier you catch something, a diagnosis or a problem, the easier it is to treat. So last time we were chatting, I think we got into the kind of the 30s. And so I wanted to catch up at 40, in your 40s as a man. What should you be getting screened for? How about, let's start there, okay?
Yeah, that sounds great. Yeah, so in these kind of younger middle age years, it's really the perfect opportunity to come on in, probably be seen. My personal recommendation is probably be seen every couple of years at that point. And what you're getting when you come in is you're getting your blood pressure checked, your weight checked. You're probably getting some blood work and taking a look at your cholesterol, looking at your blood sugar levels. Even though those things might be normal, it's an opportunity to sit with the doctor, get to know them, let them get to know you a bit, because as time goes forward, as things start to creep up, it's really important that you have a great relationship and a trusting relationship with your doctor. So there's a lot of trust building that happens and getting to know one another in those kind of early middle-aged years, and identifying things that you can intervene upon early even before you start to see rises in your cholesterol or blood sugar or blood pressure levels, but things that you can just kind of nip in the bud, if you will.
I just read something the other day, we talk about kind of the silent killers out there, and that's blood pressure. And then you just mentioned blood sugars. And actually just yesterday or day before, I read something that now they're recommending at 35 physicians start looking at blood sugars.
Yeah, absolutely. I got to be careful because I could talk about sugar for hours, but I do believe, it's my personal view, that we absolutely overconsume carbohydrates in our diet, and it's a real staple in many of our diets, including I don't know many patients who don't put that side of starch with their meal, including pasta, rice, bread, potatoes. And those are really to me, those are the silent killers, because we don't necessarily see rises in blood sugar levels, but we can start to see some metabolic changes and some insulin resistance developing. Really, the type 2 diabetes is where we fall off the cliff, but that's been a long time in coming. So we can live in this pre-morbid state where we don't have anything wrong with our blood pressure or blood sugar, but we're over consuming carbs. And at some point we might start to see a rise. And it's usually there where people say, but I haven't changed anything. And I'd say, yeah, but we've probably been over consuming carbs for a long time. So it's really an opportunity early on just to get some education about healthy dietary habits.
Okay, we've gone in the early middle ages as you described it. How about in that 50-year range? What are we looking at when I'm 50?
Sure. Well, and things are changing in terms of guidelines for cancer screenings, but really 50 has been this age where we started to talk to people about colon and prostate cancer screening in men. The prostate cancer is the number one cancer in men, and colon cancer is the third most common cancer. But there are some changing guidelines recommending that maybe to start screening for colon cancer at age 45. So again, in that 40 to 50 year range, it's important to come in every few years because things do change, and the guidelines may adjust again. But and we're in the midst of a pivot. But every 50-year-old I start to talk to about colon and prostate cancer screening on top of those other things: the sugar, the blood pressure, the weight, the cholesterol. And so we start to add in cancer screening. And I'll come back to colon cancer screening, but I'll just put a plug that to me, it's most important to find the test that's right for the patient. It's not all about just it's a colonoscopy or nothing. I have a lot of patients who are reluctant or hesitant to come in because they think it's got to be a colonoscopy and they just don't want to do a colonoscopy and they therefore don't get screened.
Back with Shannon O'Kelly and Dr. Tyson Hawkins next on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
We're continuing to talk about men's health screenings with Tyson Hawkins and Shannon O'Kelly.
Dr. Hawkins, again, man, thank you so much for taking the time to spend with us here on Health Talk, talking about screening, men's health screening. I want to drill down a little bit here. You were talking about at that 50-year-old range, I was one of those guys that was like, gosh, if I go to the doctor, I'm going to get prescribed a colonoscopy, man. That doesn't sound like fun, So you're hesitant, right? I mean, that's human nature. Let's talk about the special tests that are out there.
Yeah, absolutely. So again, one of the things I work really hard to do with my patients is make sure that they understand that there are some options. And I would encourage all patients to ask their doctor, are there options for these screening tests? So in terms of colon cancer screening, again, the colonoscopy remains the gold standard test. And I don't think there's any doctor out there who wouldn't still recommend a colonoscopy, but it's not right for every patient. And I've got plenty of patients who say to me, I prefer something less invasive. I really don't want to do that bowel prep. Is there something else I could do?
Mm-hmm.
And the answer for the right patient, and again, you've got to work with your doctor and find out if you're an appropriate candidate for this, but there are some other tests available, stool-based testing that do not require doing the whole colonoscopy prep and going in for the procedure itself. So again, it's worth coming in. It's worth not avoiding your doctor thinking it will inevitably be a colonoscopy. It might be a colonoscopy, but I'll tell you, my patients tell me time and time again, the colonoscopy was no big deal. It was just the prep that was no fun. So definitely worth talking to your doctor about and finding out what's the right option for you, because the best test is the one that's the best fit for the patient. So
yeah. I mean, good stuff. I'll tell you right here, personal experience. I was one of those people that, oh my gosh, got to get a colonoscopy. Hey, everybody out there listening, it's no big deal. Really, it's not. It's not a big deal.
In terms of prostate cancer screening, cancer screening is a controversial kind of moving target. So the major test that we have is the PSA. This is a blood test, prostate specific antigen. And again, this is something that really you just need to have a conversation with your doctor about the risks and benefits of getting this test. There's a high risk of false positive with this test, meaning that it could show that it's elevated and that might not be cancer. And you might end up going for a further test to find out if it is. And that can cause a lot of anxiety. And sometimes the procedure has risk to find out if it is in fact cancer. But not screening probably also isn't the right answer. So finding an interval of testing and what's the right test for you, again, comes back down to, do you have a relationship with your doctor? Do they understand your temperament? What's going to work best for you? I've got some patients who want the test every single year. I've got other patients who say, I don't ever want that test. Neither is right, but both is right for that patient.
Yeah. Dr. Hawkins, this is awesome information. Here we are. We're running out of time again. As we wrap up here, I will tell you and our listeners, I know if these cancers, prostate and colon, are caught early, they're treatable. So get your test out there, you guys. We're going to have you back for part 3 of men's health, because we still got to get into the 60s, 70s, because those are pretty important years too. Dr. Hawkins, thank you so much for your time.
Thanks a lot, Shannon.
You've been listening to Dr. Tyson Hawkins, internal medicine practitioner at PeaceHealth Medical Group in Whatcom County. You can go to peacehealth.org to get more information. Shannon, we've discussed it before, but we have to be a little more vigilant when it comes to our health and making sure that we're screened for all these important things and milestones in our life.
Absolutely, Tom. We all know, particularly listening to Health Talk and having so many physicians on and other providers on, early diagnosis equates to increased treatment rate and successful treatment, I should say.